Wi-Fi voltage that's
Thank you, Ms. Pal, for such a wonderful performance. Moving forward, now with pride and joy, I invite Dr. Alka Tajmi, ma'am, Principal of Vibrant Nursing College, Surat, and a Secretary General of Nursing Scholars Society, to deliver a welcome speech. Over to you. Yes, ma'am. Yes, ma'am. You are audible, ma'am.
Learn to be alone and to like it. There is nothing more freely empowering than learning to like your own company with the code. A very warm good morning to one and all present over here. Thank you to each and everyone for being with us physically and virtual platform. I'm very pleased to be able to welcome those of you that have been a long time. I feel extremely privileged and honored to be given the opportunity to welcome you all. First of all, I just want to brief about Vibrant Nursing College.
Would you kindly?
Yes, ma'am. Yes, ma'am. You are muted. Ma'am, you are
Please,
muted.
please ask others to mute. We cannot hear Madam Alka.
Please, everyone,
Participants?
check your mics. Mute your mics, please, everyone.
Good morning, everyone. Thank you to be each and every one of you for being with us physical and virtual platform. I'm very pleased to be able to welcome those of you that have been a long time for Nursing Scholar Society. And I want to brief about my college, Vibrant Nursing College. This is Vibrant Nursing College, which is situated in Surat, Gujarat. It is managed by Sri Swaminarayan Education Trust. Our founder is Guru Varya Sri Swami Shastri Swami Sri Harivallabh Das ji. Vibrant Nursing College are running. There are branches of our college. Sri Swaminarayan Education Trust. We are having MSc Nursing, Post BSc Nursing, Basic BSc Nursing, ANM and GNM. This is another branch of our college. This is college building of Vibrant Nursing College. This is another branch which is in a Chikhli, Navsari district. This is School of Nursing, SSTJ School of Nursing, which is in a Surat, Ved Road, which having ANM and GNM course, both we are running. This is Sri Swaminarayan School of Nursing, which is situated in Adajan, Surat. I already told this, these are the courses we are running in a Vibrant Nursing College, along with physiotherapy also. These are our trustees, Dr. Dinesh Bhai Gondalia, Mr. Himat Bhai Gondalia, Mr. Kamlesar Jagani. Parth Gondalia is the administrator of our college and trustee also. These are some activities we are running in our college, that is annual program. These are activities, a lab we are doing in our college, the various labs. This is also activities we have done in our college. Telenursing courses, I'm very happy to announce this. We will shortly started a telehealth nursing course, which will be very beneficial for all the nursing fraternity. There's a proverb: if your action inspire others to dream more, learn more, do more, and become more, you are a leader. At most gratitude, I welcome Dr. K.N. Chavda, sir, a Vice Chancellor of Veer Narma South Gujarat University. Sir is having huge experience in education field. We are pleased to have you, sir, in this virtual conference. This is in his busy schedule. He have given a time. Thank you so much, sir. Welcome you, sir. Second, Dr. Swaresh Narula Khanna, ma'am. She is a patron of Nursing Scholar Society. She is not present physically over here, but she have given blessing for us. Thank you so much, ma'am. There is no point to living life unless you make a history. And the best way to make a history is to help others. We are very grateful to have you, ma'am, in our nursing profession. There is none another, Dr. Bimla Kapoor, ma'am. You are idol for every nurses, ma'am. Thank you for being with us. Welcome you, ma'am. Yes, actions speak louder than the words. Always I am saying for our beloved Dr. Pragnaben Dabi, ma'am. Pragnaben Dabi, ma'am, is a registrar of a Gujarat Nursing Council. I am very grateful for your glorious present, ma'am. Your work is inspiring us day by day, and we are very happy. We are every day, we are seeing you, and we are doing the same, or we are telling to our student also. Yeah, we will be like a ma'am. There is no introduction is required for Aya Kadiwala, sir. He is a very well-known personality in a Gujarat, and at most gratitude, I welcome you, sir. Sir is the president of vice president of Gujarat Nursing Council, and he is a TNA advisor in a Gujarat branch.
Deep discussion ಮಾಡ್ತಿದ್ರಲ್ಲ.
Participant, please mute yourself. Taking our morning further, I heartily welcome to trustee of Vibrant Nursing College, Sri Swaminarayan Education, excuse me, Sri Swaminarayan Education Trust, Mr. Dinesh Bhai Gondalia. With his support, we are successfully organized this virtual conference. Welcome you, sir. I would like to express my gratitude to Professor Binu Jo, sir, a president of National Nursing Scholar Society. With his support and presence, we are organized and arrange this conference. I'm very grateful to you, sir. Welcome you, sir. I'm very happy and very grateful to all our eminent speaker, Dr. Rebecca ma'am, Professor Vaishali Taksande ma'am, Professor Suchita Samant ma'am, Dr. Srimani Pille ma'am, Professor Parul Kibliwala ma'am, Dr. Sukhpal Kaur ma'am, Dr. Ravindra sir, all are respected moderator also, Sister Tessie Sebastian, Professor Dinesh Bharadwaj, Dr. Amandeep Bajwa ma'am, Mrs. Hetal Patel, Mrs. Sweta Rasaria, Dr. Sri Kala Rajesh, Dr. Mohammad Hussain, Dr. Malti Lodi, and Professor Virendra sir. Now, I heartily welcome to all the organizing committee members, Dr. Priyesh Jain, Professor Himanshu Trivedi, Dr. Indravati Rao, Dr. Sudha Singh Mohe, Professor Anuj Jaikuti, Mr. Parth Gundalia, Ms. Sonal Wala, and Dr. Komal Modi. Welcome you all. Thank you so much for joining with us.
Thank you very much, ma'am, for a thoughtful welcome address. Now, मैं अभी डॉक्टर केन चावड़ा सर की जो वाइस चांसलर है वीर नर्मद साउथ गुजरात यूनिवर्सिटी के, उन्हें रिक्वेस्ट करूंगी कि वो कॉन्फ्रेंस के विषय में कुछ शब्द कहे और अपने ब्लेसिंग्स दे. प्लीज सर. Sir is on the way. Will join soon. Moving forward, I would like to request Mr. I.A. Kadiwala, sir, Vice President of Gujarat Nursing Council and member of Indian Nursing Council, to say few words regarding this event. Welcome, sir.
Good morning to all. आज के चीफ गेस्ट डॉक्टर विमला कपूर मैडम, वाइस चांसलर डॉक्टर के चावड़ा सर, हमारे गुजरात नर्सिंग के रजिस्ट्रार रिस्पेक्टेड डॉक्टर प्रज्ञाबेन ढाबी मैडम, ऑल इनवाइटी एंड ऑर्गेनाइजिंग कमिटी. सबसे पहले तो मैं बधाई देना चाहता हूं वाइब्रेंट नर्सिंग कॉलेज की पूरी टीम को, जिन्होंने वर्चुअल कॉन्फ्रेंस रखा है. साउथ गुजरात में डॉक्टर इंद्रावती राव है, डॉक्टर अपने वाइब्रेंट के प्रिंसिपल हैं. ये सभी टीम मिलके अभी नया कुछ कर रहे हैं. तो पूरे साउथ गुजरात के जो प्रिंसिपल हैं उनको मैं बधाई देता हूं. उनके साथ सब जुड़े हुए हैं. अभी तो रविंद्र सर है, प्रियेश जी है, विनोद जी है, तो गुजरात में एक एजुकेशन का हब बनने जा रहा है। तो सब प्रिंसिपल और उन पूरी फैकल्टी को मैं बधाई देता हूँ। आज अच्छा हुआ मैडम विमला कपूर अपने साथ है। मैडम गुड मॉर्निंग। हेलो,
Good morning. Good to see you,
गुड
Kadiwala.
मॉर्निंग।
Very good to see you.
मैडम विमला कपूर जी जो है इग्नो के कोऑर्डिनेटर थे, हमारे ट्रेन नर्सिस एसोसिएशन ऑफ इंडिया के सबसे सीनियर और बोले जाते हैं ना बाहोश में से एक है। मैडम आपको देख के बहुत अच्छा लगा और आपके नेतृत्व में आज जो होने जा रहा है गुजरात के लिए जो होगा वो अच्छा ही होगा। बीनू जी और उनकी टीम गुजरात में कुछ ना कुछ करते रहते हैं, तो उनकी टीम को भी आप प्रोत्साहित करते रहिए। एक समय था, मैं सबको बोल रहा हूँ कि हम टीएनआई में जा रहे थे तब गुजरात बिल्कुल बोले जाते हैं कि एजुकेशन में बिल्कुल पीछे थे। आज गुजरात ऐसा है कि डॉक्टर प्रज्ञा डाबी ने जब से गुजरात नर्सिंग काउंसिल का रजिस्टर पद ग्रहण किया तब से अब तक एक डायनेमिक लेवल से, हाई लेवल से बोलो तो भी कोई कम नहीं है, बहुत अच्छा करने जा रही है वो मैडम। तो ये कॉन्फ्रेंस को मेरी बेस्ट विशेस है और दोबारा कभी भी कुछ भी गुजरात में कोई भी फैकल्टी या कोई भी कॉलेज कुछ भी रखते हैं तो हम गुजरात नर्सिंग काउंसिल की ओर से और एसोसिएशन की ओर से हमारा सहयोग रहेगा। और मैं चाहता हूं कि कोरोना का थोड़ा समय कम होने के बाद मैडम विमला कपूर जी को गुजरात दोबारा बुलाइए और पूरा गैदरिंग सूरत या अहमदाबाद में रखिए, क्योंकि उनके पास बहुत ही नॉलेज है और बहुत अच्छा आइडिया भी रहता है। तो शब्द यूज के जो भी हमारे फैकल्टी स्टूडेंट्स थे वो अभी एमएससी होके कहीं ना तो मैं हार्टली करता हूँ। और मुझे ये वर्चुअल कॉन्फ्रेंस में विमला कपूर जी का दर्शन करने का मिला, इसलिए उनको आभारी भी व्यक्त। थैंक यू वेरी मच।
थैंक यू सर फॉर योर वैल्यूएबल वर्ड्स। नाउ हमारे बीच में चांसलर सर आ गए हैं, तो मैं उनको रिक्वेस्ट करना चाहूंगी कि डॉक्टर के एन चावड़ा सर की जो वाइस चांसलर है वीर नर्मद साउथ गुजरात यूनिवर्सिटी के, उन्हें मैं रिक्वेस्ट करूंगी कि उस कॉन्फ्रेंस के बारे में कुछ वर्ड्स कहें। वेलकम सर।
जिसने बातें की वो इकबाल कड़ीजी वाला जी, जो गुजरात नर्सिंग एसोसिएशन के प्रेसिडेंट ने, उन्होंने जो बात कही वही मैं बात फिर से दोहराता हूँ कि आदरणीय बिमला जी को जब भी ये कोरोना है तब होने के बाद आप अचूक याद कीजिए। और अगर ऐसा कोई कार्यक्रम करना है तो आगे भी मैंने आदरणीय कड़ीवाला जी से बात की थी कि आप कुछ भी ऐसे इवेंट रखना चाहते हो और यूनिवर्सिटी कैंपस में रखना चाहते हो तो अपने पास सभी लोगों का आशीर्वाद और शुभेच्छा से अ, अच्छा इंफ्रास्ट्रक्चर है। एक साथ 5,000 गाड़ी आती है तभी हम पार्किंग कर सकते हैं, कॉन्वो भी अलग हो सकती है। तो यहाँ रखिए जब भी आपको टाइम मिले। और फिर से ये पूरी कॉन्फ्रेंस में और भी एक जो आदरणीय कड़ीवाला जी ने बताया कि जो अभी स्टूडेंट्स पास होकर जाएंगे उनको यही एक रिक्वेस्ट करूंगा कि अपनी यूनिवर्सिटी जो है वो 1755 किलोमीटर यानी 1800 स्क्वायर किलोमीटर में है। वो भारत की एकमात्र यूनिवर्सिटी। आजकल तो आपकी ही नर्सिंग कॉलेज जो है लक्षद्वीप में भी है, जिसमें भी हमें आपका सहयोग चाहिए, सात समुंदर पार। और बाकी भी सभी स्टूडेंट से मैं यही रिक्वेस्ट करूंगा कि ये कोरोना काल में आप जो कर रहे हो भगवान के बाद आप ही हो। डॉक्टर तो क्या है कि वो अपनी प्रिस्क्रिप्शन लेके अपनी दवाइयाँ लेके दूसरे विजिट जाता है। अगर पेशेंट जीता है या फिर एंटरटेन करता है तो वो जो भी है वो नर्सिंग लोग ही करते हैं। मैं भी अभी ज़्यादा दिन अस्पताल में रहा तो पूरा पूरा दिन मेरा नर्सिंग स्टाफ ही मेरी केयर करते थे। डॉक्टर तो आते थे, नहीं मना नहीं, पर वो हर 1 घंटे आके वो वगैरह वगैरह करके जाते। बाकी का टाइम हर बार कुछ भी हो तो इसीलिए आप भगवान के बाद आप है, ऐसा नहीं है। तो आप में हम भगवान देखते हैं, तो आपको यही करना है कि जो हमारे 1,40,00,000 है, इनका हेल्थ कैसे, प्रिवेंशन इज बेटर देन क्योर। आप हमें वहाँ जहाँ हो वहाँ हमें वहाँ है कि जो लोग आपके सामने हैं, ट्राइबल बेल्ट है 35%, जहाँ हो वहाँ बहुत सारा अभाव है, आप भी अच्छी तरह से इनको इंटरप्रेट करते हैं, तो आप कीजिए। और फिर से यही कॉन्फ्रेंस को मैं अपनी यूनिवर्सिटी की ओर से और पूरे यूनिवर्सिटी परिवार के सभी आदरणीय विभागीय वड़ाश्री, आदरणीय सेनेट, आदरणीय सिंडिकेट, आदरणीय काउंसिल और पूरे हमारे दक्षिण गुजरात यूनिवर्सिटी विस्तार की 1,40,00,000 की जनता से और से आपका ये जो सेमिनार को मैं शुभेच्छा देता हूँ कि अच्छी तरह से करें। और पूरे नर्सिंग स्टाफ परिवार को यही कहता हूँ कि ऐसे वर्चुअल तो वर्चुअल आप करते रहिए। पुनः एक बार मैं कॉलेज का आभारी हूँ कि जो मुझे यहाँ न्यौता दिया। और मैं कोरोना है इसीलिए मैं नहीं आ पाया, उसके लिए मैं दुखित हूँ। और आप सबका शुक्रिया। वंदे मातरम। भारत माता की जय।
Thank you so much, sir.
थैंक यू सो मच सर। मैं बताना चाहूंगी कि सर की हेल्थ ठीक ना होने के बावजूद भी सर ने अपना कीमती वक्त हमें दिया, इसके लिए बहुत बहुत शुक्रिया सर। थैंक यू सो मच सर। मूविंग टूवर्ड्स, words may inspire, but actions create changes. To signify this word, it is my pleasure to introduce our guest of honor, Dr. Bimla Kapoor, ma'am. Ma'am, I welcome you and invite you, and also for the giving your blessings. As we all know how big personality she is, ma'am has got so much honors and awards. If I will tell this, it will take hours of time. So I will briefly introduce her. Dr. Bimla Kapoor has extensive experience in a field of nursing, pedagogy, and administration, spanning more than 5 decades. She is a respected member of nursing community in India, with the first textbook on psychiatric nursing in a country to her credit. She has further cause of qualitative improvement in a nursing health care and global level through her research, paper presentation, consulting activities, and upskilling of nursing profession. Ma'am has completed her PhD from the IGNU at a first scholar. Also completed her post-graduation diploma in distance education, completed her MPhil in nursing, master in nursing, then bachelor in nursing from the Raj Kumari Amrit Kaur College of Nursing, Delhi University. She is a nursing professional who believes in a lifelong learning. She is a chairperson of Committee of Experts in a National Nursing and Midwifery Bill 2020 with MOH and FW Government of India. She has been active member of TNI throughout her career, a life membership of various nursing societies and associations, a consultant to many universities and NGO. She has also consulted at FHI 360, EDCIL, WHO, UNICEF in a various areas of nursing. Ma'am is holding this post. Dr. Bimla Kapoor, she is a chairperson in Committee of Expert National Nursing Commission Bill 2020, former director and professor of School of Health Science IGNU, former HOD of CNE and Psychiatric Nursing Department of Rajkumari Amrit Kaur College of Nursing, Delhi University, advisory consultant in nursing and allied health science, former dean for the Berkeley Health Education, former dean in IL and FS Skill Health Academy, and former advisor nursing and allied health in MIHER. May I now welcome Dr. Bimla Kapoor, ma'am, to unveil the theme of National Virtual Conference and give the blessings. Over to you, ma'am. Welcome, ma'am.
Thank you very much. Good morning, everyone, and have a very, very pleasant morning. Before I get into my formal unfolding of theme, I just want to say a few words about the Vice Chancellor, uh, our Dr. Kabra. I've heard many of the Vice Chancellors, but a few words which he spoke from his heart. And very, very rarely I've heard the Vice Chancellor speaking in such a simple words and appreciating the very, very important team members of the health in the country, and that also in Gujarat. I would like to thank you, Dr. Chawla, for being so humble and so concerned about the nursing professional that you opened up the whole university for nursing professionals to come and have any kind of conferences. Thank you very much once more on behalf of the country and on behalf of Gujarat. Of course, Kadiwala, you are the limelight of the nursing profession in Gujarat. And now that you have a very, very strong team with the registrar of Dr. Pragna Bhen and the other team members, especially Binu and the other team members, and Vibrant Society principal is also the secretary. So I'm sure you can do lots of wonders. You said Gujarat is becoming an education hub. I think Gujarat is already an education hub. So with these few words, let me get into the formal task which is assigned to me, and I would like to share my few thoughts. Mr. Binu, President Nursing Scholar Society of India, Dr. Khanna Pedran, who is not present physically. Of course, we have our Vice Chancellor, Dr. Chawla, of Veer Narmad South Gujarat University, Dr. Pragna Ben, who is our Registrar of Gujarat Nursing Council, Mr. Dinesh Bhai, who is the Chairperson of Vibrant College of Nursing, Dr. Alka, Principal of Vibrant College of Nursing, Mr. Kadiwala, Mr. Kamlesh Bhai, Executive Members of National Nursing Scholar Society, faculty members of Vibrant College of Nursing who have done lot of efforts to organize, first get into the physical and then getting into the hybrid kind of conference, which demands lot of efforts on the part of Vibrant College of Nursing. Very, very esteemed speakers. The speakers are excellent, which are selected by the team. Very dear students who are sitting over here, nursing colleagues in India and world over. Good morning once more to each one of you, and happy day in Gujarat. Let me first thank the organizers for having invited me to unfold the theme on hallmark of excellence in nursing research. The very fact that the Vibrant College of Nursing and Nursing Scholars Society has thought of organizing these 3 days conference, not a workshop, conference, indicate that there is a belief of nursing professionals in Gujarat and also at national level to see to the hallmarks or standards of nursing research which is being conducted in the country and also which is being conducted in Gujarat. I'm going to make a very huge request to Dr. Pragana Ben after some time, after I finish up my discussion. Well, we all know that nursing is something where we provide care to the client at promotive, preventive, therapeutic, and rehabilitative level. All the levels care is being provided by the nursing professionals. And this is provided with body of knowledge, acquired competencies based on theoretical concepts and models, with attitude of helping and caring the people. Now, if you remember your very first session or lecture in nursing as a student, we always talked about the knowledge, that is head. We talked about the attitude, that is our heart. And we talked about the competencies or the skills that we talk about the hands. The head, the heart, and the hands, which goes together in the profession of nursing to care for the people. Now, a study on providing backup to a woman was conducted by one of the nursing students at master's level, where she found that if she gives a back rib to the mother who is delivering her baby, not only gives comfort to the mother, to the woman, but also it helps in easy delivery. What a small task. what a small responsibility or a comfort measure, but look at the effect of it, which the mother or the woman remembers throughout life. The other study also it provided a lot of psychological support because the woman thought that there is somebody with her who is hand holding of hers during the difficult time. A study on ensuring that the epithelial layer while doing the bedsore dressing is not pulled out helped in the healing process of bedsore, and also seeing that there is improved time and the healing of the bedsore was faster. These studies have been done 30 years back, 40 years back, but we were able to bring a change in the patient care. There are many studies on preventive teaching approaches which have been done. Very often, when the nurse has taught to the young women about the self-breast examination. And this self-breast examination, I remember a student from St. John College of Nursing in Bangalore. She did a study on the breast examination of the community, the nullipara or the unmarried women. And she found that there were so many of them who were suffering from the stage 1 of breast cancer without even knowing it. So she made it a habit that in the colleges she really taught about the self breast examination, and this also study was done, I think, 30-35 years back. Now these studies made lot of difference in identifying the girls who were suffering from cancer and also going for the preventive surgery so that they did not get into complications. There are many research studies done by the nursing professional where the quality of the life of patient has changed. Look at the teaching done by the nurses on ostomy care. Gastrostomy, colostomy, talk of any ostomy care. Interestingly, a nurse took up a study in one of the villages on helping the women on self-examination during a self-examination of cervix. She asked them to use a mirror, and with the help of the mirror, she said, you examine your cervix. And many of them, they were able to identify that they were suffering from, cancer, or they were suffering from some kind of abnormal changes which they reported to the gynec. Also, they found that there was some white discharge coming out, which was marked leukorrhea, which was leading to backache. So this was a very, simple approach by a nurse, but it helped. This study was in Wardha. So it went long back to Gujarat. Again, I think it was 25 years back, or more than that, this study was done. So the studies have been done by the nursing professional on these areas. There are also very many nurse-led studies done on teaching programs on prevention of heart problems, on prevention of gastric ulcer, on prevention of colonic ulcers. Research studies have also been done to improve the mental health of adolescent, mental health of adolescent boys and girls, mental health of elderly people, older adults. The studies have been done. Now, if this is the scenario, then why the nursing research does not have visibility in the healthcare system? I have given you very few examples. Tell any of the teachers to stand up, they will quote hundreds of studies. Tell any of the nursing service to stand up, they'll quote more than 50 studies. Studies have been done by the nursing professional. They make the difference. But what is the reason? Why there is no visibility of nursing research in the healthcare system? Probably we are not started implementing and show the results in the nursing profession or in healthcare system. We have done these studies, but we have not replicated them and tried to use it in the hospital setting where we could bring a change in the patient's cost and also become a cost effective for the hospital. We have not done that. So where have we gone? Where we need to strengthen. We need to have a nursing research department which keeps gearing up the implementation of the studies done by the students, studies done by the nursing research people, studies done by the TNAI members, and that need to be implemented to bring change in the patient care. This will help us to have our own hallmark, our own standards, and we will say that this is what is required in each specialization. I know the organizing committee has, along with the Vibrant College of Nursing, I'm so happy to see the word vibrant. So I can imagine everybody is vibrant over there to see that the changes are brought in. They have really picked up excellent speakers. But I have one or two requests to make to Dr. Pragna Ben, because I can, talk on behalf of Gujarat nurses, and I'm sure they will support me. Madam, please open a research cell. And in that research cell or research department or research division in the council itself, which should have the, parallel director or parallel in charge of the research cell, plus you can have 2-3 faculty members, whichever research studies of the masters who have done during their master's program, they have done it, try to implement, try to ask 3-4 hospitals as a pilot to implement that study and see the changes and show to the healthcare system in Gujarat that the nursing studies done by the nursing professional had made difference in the recovery of the people, stay of the patient in the hospital, thereby reducing the cost of the hospital as well as cost to the patient and to the relatives. This is my request to Madam Pragna Ben, and also Vice President, we have Kadiwala. And I would like to see that if this can be done by Gujarat, which is very, very innovative, very progressive, very thought-provoking, and as said by Kadiwala, that it is becoming an educational hub, but it can also become a caring part from based on the research, based on the evidence. So this is my request to Gujarat Council to take up this responsibility. With these few words, I will wish all the success for those who have organized this Vibrant College of Nursing, your team, your chairperson, your trustees, and also the National Nursing Scholars Society. All the very success for this 3 days conference. God bless you all. Stay healthy and stay well. Thank you very much.
Thank you so much, ma'am, for bringing the light to the theme of National Virtual Conference. Your thoughtfulness is gift for us. Moving towards, leader instill in their people a hope for the success and belief in themselves. To denote these, let us move on the next distinguished to honor us with her presence is Dr. Pragna Ben Davi. Ma'am, I welcome you and welcome you. Ma'am had completed her diploma and degree and master in nursing from the Gujarat Nursing University. Also did her PhD in nursing. She has done CGFNS from Philadelphia, United States of America. She also obtained postgraduate diploma in advanced clinical research from the Gujarat University, as well as post-graduation certificate in quality management and accreditation of the healthcare organization from Noida. She has also completed LLB from the Gujarat University. Currently, name is pursuing in Master of Law from Gujarat University. She has a vast experience in a variety of area in nursing field, more than 13 years of experience in clinical area, 8 years of teaching experience, 3 years of administrative experience, and since 2016, she is working as the Registrar of Nursing Council of Gujarat State. She has played a key role in the editorial board of publication of newsletter for the Gujarat chapter song in preparing module of strengthening midwifery practice for the safe motherhood under the National Rural Health Mission program. She is an important member of the advisory board in the Journal of the Advanced Health Information. Ma'am has also member of editorial board in various international journals like International Journal of Nursing Science, Practice and Research, International Journal of Obstetric, Perinatal and Neonatal Nursing, and International Journal of Orthopedic Nursing. She is a various professional membership in a different association and organization, both national and international. like SOMI, the Nursing Teacher Association, National Research Society of India, Gujarat Nursing Association, Indian Association of Neonatal Nurses, Trained Nurses Association of India, Nurses Educator Association, and Academy of Hospital Administration. She has also participated as a resource person in a nursing administration and accreditation standard training organization by the government of Gujarat and also in many other organizations. She has been member of draft committee for SOPs and policy development of Gujarat District Hospital and Medical College. She is also internal assessor at a national quality assurance standards. She has also participated in ethics committee accreditation program too. I invite you, ma'am, to outline our great understanding of the nursing research. Over to you, ma'am, and please give the blessings of you. Welcome, ma'am.
Thank you very much for such a nice introduction. Respected Bimla Kapoor, ma'am, we are fortunate that you are with us, ma'am. As such, this conference was planned physically, but somehow due to COVID, we need to organize it virtually. But I had planned to stay with you, and really, we are lucky that you are with us. And I thank Vibrant College of Nursing and Nursing Scholar Society to give us this platform, and as a result, ma'am, you are with us. Your guidance and your presence is really a matter of proud for us, ma'am. Thank you very much, ma'am, for being a part of this conference, and your valuable guidance we definitely implement in Gujarat. That we will have this research cell. We have, as you said, that vibrant word is itself, it says many things. So we are having a vibrant nursing college, and apart from that, many vibrant leaders with us, like Binu sir is there, Himanshu sir is there, our Kadiwala sir is with us always. So we are having many vibrant leaders with us. And if your guidance and motivation will be with us, we will definitely do that. Madam, you said in your session that many nursing researches are there. We need to put it into the practice. And what is that? There is a meaning of translating research. From the benches to the bedside, that is the concept, that whatever we learn in the classroom, whatever we learn in the laboratories, whatever we conduct research, we need to put it into the practice. And as your advice of nursing cell, that whatever the researches are there, what our findings are there, if we implement those findings in real practice, and then there will be definitely a good result, and we can provide qualitative nursing care, and that helps us to bring healthy society, and there will be the cost effective care, and there will be the little stay of patient in the hospital. So thanks a lot, ma'am, for giving this vision to us. First of all, I would like to greet all of present here, chairperson of this conference, Dinesh Bhai Gondalia sir, Iqbal Kadiwala sir, president of National Scholar Society, Binu Joy sir, and Alka Tajne ma'am, who is a principal of Vibrant Nursing College, and she is doing, along with her team, she is doing really hard work for making this event successful, ma'am. You did really very good job. I really appreciate you, ma'am. And now whatever assignment is given to me, that is overview of nursing research. So let us move towards that. So next slide, please. Okay, so we all know what is the meaning of research. Research means search, and search means looking into, or we carefully analysis anything. Or so the word research means to search again, or to examine carefully. A research is systematically inquiry or study to validate and refine existing knowledge and develop new knowledge. So whatever existing knowledge is there, every phenomena there is a continuous changes. As ma'am said that there are many factors. Previously we did some research, now we are doing some research. So accordingly, whatever the phenomena is there, there will be some new result. And to validate those findings and to refine what is the existing knowledge, we need to continually update ourselves. So research will be helpful for that, and our ultimate goal is research is to develop a body of knowledge for a discipline or professions such as nursing. Next slide, please. So research can be defined as the search for knowledge or as any systematic investigation with an open mind to establish novel facts, solve new or existing problems, prove new ideas, or develop new theories. Each word mentioned in this definition is very important. First is the systemic investigation. We are doing scientific and systemic investigation. It is not haphazardly. It is a scientific, it should be an orderly process. Then with open mind and to establish novel facts, we want to identify, we want to establish novel, means new facts, solve new or existing problems. Whatever problems are there in nursing profession, we want to identify, and there should be a solving approach. So, and prove new ideas. We must bring out with the new ideas and to develop new theories. Next, please. So research means to search again, or to examine carefully. It is systematic inquiry or study that validate and refine existing knowledge and develop new knowledge, as we just discussed. Research is thus an original contribution to the existing stock of knowledge, making for its advancement. So whatever is there, knowledge is there, we refine it and we develop new knowledge. Next, please. There are many other definitions of research. Again, research is the systematic method of exploring, describing, explaining, relating, or establishing the existence of phenomena, factors that causes changes in the phenomena, and how the phenomenon influence other phenomena. So this is a comprehensive definition. So in research, what we do, we describe whatever the fact is there, we describe it, we go in the depth, we explore it, we identify relationship, and we explain it, and what is the new, what are the factors that affect the phenomena, what are the factors that influence on the other phenomena that we identify. So it is a scientific, systematic, controlled, orderly, and objective, we can say empirical investigation to develop, refine, and expand the body of knowledge. Next slide, please. So scientific research is, again, this is the same definition. Next, research may be defined as the systematic and objective analysis and recording of controlled observation that may lead to the development of generalization, principles, theories, resulting in prediction and possible ultimate control of events. So we analyze the data, we observe the data, we do the analysis, and with good research, we can generalize what are the result is. We can have principles, we can develop theories with the help of research, and with the data, we can predict what will be, and if anything wrong may be the result, then we can control those situations. Next. 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 So need of nursing research. First is the providing basics for professionalism. Any research in any profession that helps us for the basic for the professionalism. So in nursing also, it provides us basis for the professionalism. Our prime objective is to provide qualitative care to the patient. So what we can do, how we can prepare students who can provide a qualitative care, how can as a nurse we can be a best that we can provide a qualitative care to the patient. That will be our prime motto. So to provide this care, we can, through the research, we can have idea that how, what are the phenomena that can influence to give better nursing care to the patient. Then discovering new measures. Okay, as just madam told that there are many researches which was conducted by the nursing students and nursing faculties. So they suggest different measures. So how this measure, we can discover those measures. Ultimately, it will lead to the, give qualitative nursing care to the patient. Then refining the existing theories. There are many nursing theories at present. So at per the present scenario, what can be the new, how we can add it, so that like that way we can refine the existing nursing theories. Then filling the gap in knowledge and practice. It is very necessary that we are having the knowledge, but there is a gap what we have a knowledge and what is in the practice. So whatever there in the knowledge or whatever is there in the classroom, if we break into it into the practice, then it will be really good for all of us. Then improve the standards in nursing education. If we conduct research in nursing education, nursing administration, then with the help of those data, we can improve the standard of nursing education too. Then fostering commitment and accountability. How we can foster this commitment and accountability? If we are knowledgeable, if we are having a good knowledge and skill, then we can provide good care, we can assure for the good care, and it will be our commitment and our accountability. Next slide, please. So major purpose of nursing research is to identify the fact, to describe the fact, to specify the fact, to evaluate the fact, to explain the fact, and to explore the fact. So these all are the major purposes of nursing research. Next, please. So in this conference, this focuses on the research are systematic review and meta-analysis. Meta-analysis is very important because we are conducting nursing research in different geographical area and different setting. So what are the different results in those studies? We can analyze those data and we can generalize the result of that particular studies. Then sampling and sample size is very important for generalization of our results. So power analysis is needed. So the very crucial topic, sampling and sample size, is covered here. Then issues and strategies to overcome nursing research. There are many issues in nursing research to get permission. Then there are some ethical issues and practical issues are there. So it will be discussed here that what are the issues and then how we can overcome those issues. Then translational research. This is very new topic and it is very crucial in nursing profession. As Madam said, Madam Bimla Kapoor said that whatever the research findings are there, if we implement it in real practice, so that is the true meaning of the translational research, to carry on, to put it into the practice. So this is really very a good topic which has been included in this conference. And if we really understand this approach, if we understand and implement this translational research in our practice, then it will be like a blessing for nursing profession. Research critics topic is converted, included, and then data collection and presentation. It is also very important that how you collect the data, and presentation is also very important, that how you present this data. So this is all about this research in this conference. These all topics have been incorporated in this conference. So I really appreciate organizers of this conference that you identify different topics which are really needed for nursing educators and for nursing professions. So with that notes, I end my speech. Thank you very much for inviting me, and I give you all of you best wishes for successful of this conference. Thank you very much.
Thank you, ma'am, for your fruitful and productive words. We have already shared the link, pre-test link from the here. I'm requesting all of you to fill the pre-test form and submit it by the time. Now, moving right along, we are going to start our first session of this conference. For that, I would like to introduce our moderator, Sister Tessie Sebastian, ma'am. Sister Tessie Sebastian, ma'am, is a principal and director of Srimati Radhika Bai Meghe College. Ma'am completed her Bachelor of Science in Nursing from PGI Chandigarh, Punjab University. Ma'am has also completed her Master from the Rajkumari Amrit Kaur College of Nursing in Delhi University. Ma'am served her work as a staff nurse in a St. Luke Hospital, Sriramapur, in Kasturba Hospital, and also Kishanwadi Dispensary, Koproli, Chirori district. Ma'am worked as a nursing tutor in a St. John College of Nursing, then in St. John Nation Academy of Health Science, Bangalore, and also worked at FNTCN, Swangi, Meghe. Ma'am also shared her knowledge as a lecturer and a work as a professor cum principal in SRMM College of Nursing, Swangi, Meghe. Ma'am has served post at university level being faculty of nursing science and also working as a professor cum director in a nursing acharya, Vinoba Bhave, Rural Hospital, Swangi, Meghe. Now, I request you, ma'am, to take charge to introduce our first speaker, Dr. Rebecca Sampson, ma'am. Over to you, ma'am. Over to you, ma'am. Sister Tessie Sebastian, ma'am.
A very warm good morning. Good morning, everyone. A very good morning to Ma'am Rebecca and all the dignitaries on the dais, off the dais, all the participants of this very wonderful and meaningful workshop for the day and the days to come. Here this today is vested to me to introduce Madam Rebecca. I'm very happy. In fact, I have seen you once. On that very glimpse of vision of yours, I would like to introduce you to the audience today. Today's eminent speaker and the day and the lady of the hour, I would say, Dr. Rebecca Sampson. She is graduated and mastered in her subject in the cradle of CMC Vellore. And her PhD also refined in the same cradle. She is associated with the nursing now years together, more than 40 years, I suppose, as I have
Excuse me,
gone.
ma'am. Excuse me, ma'am. Can you please start your video? Yes, ma'am. Video चालू कीजिए, please. Okay, ma'am.
Okay. And she has completed her PhD in Nursing College of Nursing, Vellore, Tamil Nadu.
Can't see your face.
Sister, very good morning. Sister, can you please keep the video of the laptop or mobile you are using little down so that we can see your blessed face? And our delegates will be very happy to see you, sister. Little more down, sister.
Are you able to?
No, sister. Yeah, yes, sister.
Ah,
Now,
no.
very nice. Very good morning. Very nice to see you.
Good morning, everyone.
Shall I continue?
Yes, sister.
Yes, ma'am.
Yes. And with these vast educational experiences, Madam Rebecca had extended her hands as a clinical instructor, junior tutor, lecturer in the colleges, professor, and dean, College of Nursing, even CMC Vellore. And even now, at present, she is working as the Director of Nursing and Research at AVMC and Hospital Pondicherry. And also, she is a life member of Trade Nurse Association, Nursing Research Society India, life member of Nursing League of Christian Society, life member of Alumni Association of CMC Vellore, life member of PhD Society of India, life member of Nursing Scholar Society. She is published many scientific papers in national and international journals. She also is a resource person for various national and international workshops and conferences. Today, she is going to enlighten us with her topic. The topics we all know in the nursing profession. It is a talk of this special topic, that is a systematic review, and the systematic review, and it's concerned with the continuation of that topic. But here I would like to say that Dr. Rebecca is going to talk on the length and the depth, the feasibility and possibility and utility of this topic, and also differences and similarities between the, and we also hear the more about that topic. The more we look into this special topic, the more compact and vivid the topic is. Let us listen to her. Madam, wholeheartedly on behalf of the organizers, I welcome you into this first topic of us today. Hearty welcome, ma'am. Welcome. Wish you all the best. Thank you.
Hello. Good morning. Can you all see the slides?
Yes, ma'am.
Yes, ma'am.
Thank you, Sister Casey, for introducing me to the audience in a very beautiful way. And also, I would like to thank the president of NSS, Dr. Binu, and Dr. Alka, Vibrant College of Nursing, principal, and all the patrons of NSS, the honored, distinguished administration of Gujarat Council and university, and all the faculty members, all the delegates, audience, and everyone. Thank you very much for the opportunity. And I hope I will do justice for my topic, as sister said, in depth, width, and heights, and whatever. So now, but I believe we are into the real real, in the concentrating on research. Okay, so Dr. Vimla Kapoor has introduced the theme, and also the previous speaker who has given the overall overview of research and its importance. Can you all hear me, my voice? Am I audible?
Yes, ma'am.
Okay.
Yes, ma'am.
So, trusting me or given this topic, I hope I will do the justice. So next slide, please. Next slide, please. Somebody sharing the slides, right? Please share this next slide. Okay, I bring greetings from my institution, and the topic given to me is systematic review and meta-analysis. Next. Now I have an outline that I'm going to talk today. Introduction, terminologies, types of systematic review, steps of a systematic review, and principles in developing protocol, and how to apply protocols in systematic review, and a conclusion. Next. Next. I think actually I have sent another PPT morning to Dr. Alka for sharing. Anyhow, now the theme that we have said is hallmark of excellence. Okay, before I go to terminologies, I just wanted to say what is hallmark, what is excellence in nursing research. That means everyone has to set their own standards. Okay, where we can, to what stage, what level we can reach up to. So this is what is needed. So hallmark of excellence, and excellence means to everyone, it is a relational. INC kept 50% of pass mark. Okay, for all the nursing graduates to be qualified to pass. Okay, that is our system of education in Indian context. When you go to a competitive exam, you cannot have the same hallmark what we have gone through in Indian system of education to be qualified to practice your nursing abroad. So everyone is trying to set their own standards, to say excellence, to be in par with. Now I just want to share a small story. Not story, it is an incident which had happened. Here, two managing directors having a conversation to purchase goods. The Indian managing director is placing order to other country to import the goods. And here he is saying, placing a request, saying, sir, I need at least 98.5%. I'm sorry, I want 99% of standard. Then the other side, the person said, sir, we cannot make 99. Then he said, okay, 98. Still the other person said, no, we are sorry, we cannot make 98. And then he came to bargain, negotiate, at least give. Okay, 98.5 and 98%. So finally, he said, if you can't give even 98.5%, then I'm canceling my order. No business transaction. So immediately, the managing director from other side of the company said, oh, no, sir, and please don't cancel the order. And he told his team, please make 1.5 error. You got my point? Please make 1.5 error. That means then our managing director from India got shocked to hear that. Said, I'm sorry. Then he said, sir, we cannot afford to make even 0.5 error. Okay, this is the hallmark of excellence. This is the standard that we are trying to, and this is the research that we are not trying to do with evidence, not talking in the air, without any facts, figures. So whatever we say, that should be an evidence, there should be a proof. That's why now every institution is going for NAC, every institution is going for NABH, every institution is trying to get national ranks, and whether your institution is in the first 5 listed or 15 or what is your rank? Where do you stand? What is your standard? What is your hallmark? So this is what we need to understand. So with this introduction, I thought I'll just go to the terminologies, the simple meaning to understand. So the given topic for me from the main theme is a systematic review, because we have to keep reviewing every day, every quarterly or whatever the frequency, periodically, where do we stand? This is a systematic research, is a systematic inquiry. Okay, that word is now making we are making an effort to understand. Review, not once for all we have done and we close the chapter. No, we have to keep reviewing periodically so that we know where do we stand, what is our hallmark. Are we improving or deteriorating in our practice? Okay, so systematic review is a review attempts to collate all empirical evidences that in pre-specified eligibility criteria to answer a specific research question. It uses explicit systematic method that are selected to minimize bias, thus providing reliable findings from which conclusions can be drawn and decisions are made. So it has to be reliable, minimize bias, so no imaginations. Okay, reliable means one cannot talk. Yes, I understand. I have heard. I have seen. Seen is something. I have heard, and there is without any evidences. So we can, before you make a choice, before you draw conclusions, before you make a decision, we have to have evidence perfectly so that we will not go wrong. Now, meta-analysis. What is meta-analysis? All gathered information. You have to analyze statistically provided from multiple studies or resources that attempt to answer the same questions. Whether it's only my study is proving or there are any other studies. When you are writing your thesis or we are writing the thesis, we are always keeping a literature support, even to calculate sample size, even to generalize your results. Are there any supportive studies to accept your hypothesis or reject your hypothesis? This is the thing that we need to understand in the analysis part. So this is meta-analysis is very important to make right decisions. Next. Next, please. So there are some differences. Systematic literature review. This attempts to identify, appraise, and synthesize the empirical evidences that meets pre-specified eligibility criteria to answer a given research question. The preparation of a protocol. Now, to understand this research in a systematic way, one should have a protocol. That is what are the steps to ensure that systematic review is carefully planned, and that is and what is planned is explicitly documented before the review starts, thus promoting consistent conduct by review team, accountability, research integrity, and transparency of the eventual completed review. Okay, so the protocol is very, very important before we attempt to do systematic review. Once we understand what is systematic review, why we want, then this will come up in a future slides I'll share. What is hypothesis? It is proposed explanation for an observation, one that may be investigated. Whether it's a scientific hypothesis, may be carried forward. There's a working hypothesis. Is there any relationship? Is there anything that we want to prove? So that is, next, please. So, understanding a little bit of terminologies. Now we are going into little more in depth. Why systematic review is needed? Why are we worried? Why are we trying to impose and introduce this in the research? Already we are doing research. Why again systematic review? So when it is faced with any questions, any clarity, you want any more clarification from the previous research. Now, for example, Covaxin, Covishield, whether 2 doses enough or boost is needed. So this kind of questions when it is arise, then you go for systematic review, developing a protocol. So that is number one purpose. Number two, important skill for any researcher to develop. So once we do, we should not be satisfied. Okay, I have done my research, that's enough. But you yourself or we ourselves can do this further to investigate what we have done is right or little more in depth we have to do. So usually we give in recommendation. Further study can be carried out from the existing study. What is done? Next is identification of the current literature. Whether any current literature is supporting or giving us any more details further to investigate. So you go for systematic review. Then it will give guidance to plan and suggest the value of novel research. So from existing research, when you do this systematic review, it will give us the guidance to go to value that and go for further research, novel research, new knowledge generation. Okay, to answer clinical questions, to make a sound decisions. So this systematic review is important. Next. Now let us see types of systematic review. What all kinds of systematic reviews we can do. When you want to do an effectiveness study or the effectiveness, when you want to test the qualitative research, the quality, then economic evaluations, when we plan, when the research is done, and then proposing, we can do this, they invent so many things, or what kind of vaccine. Now, present burning issue is COVID impact. Different variants are coming up. Different vaccines are in, research is done on efficacy of vaccination, utilization, budgeting. So all that is really very important. So economic evaluations, whether the planned program is cost effective or unnecessarily we are spending a lot of money. Economy is lost over nothing. Prevalence and incidence, whether there is any useful effectiveness is there, still is there any incidents coming up or any prevalence reduced. So these things, example, tuberculosis, short-term chemotherapy, leprosy, short-term chemotherapy. These are all lifelong diseases. Now, latest review is saying that live with COVID. It's not going to be eradicated. It is going to be endemic, which means it is going to live with us As long as we live, Corona also is going to live. It is like a flu. I'm just for for the discussion sake, I'm saying for us to understand. Oh, this is the news that we are hearing, reading. Lot of literature is coming up, and a lot of opinions are shared by scientists. Okay, these are all things are to be done. The studies can be done on incidence and prevalence rates. Etiology and risk factors. What is exactly causing? Is it a mask? You can see how the explanations or education is propagated among the masses. Okay, without both people without mask, one person with one mask and other person no mask, or both are using masks. So how much it is spread? In which group it is spread more? So this kind of things we can do the studies. And then mixed methods, use of mixed methods and efficacy. Then umbrellas, overviews, and text opinions, diagnostic test and its accuracy, scoping, mapping, reviews. How best we can do this. So these are all areas, types of systematic review can be conducted. Next. Next, please. Next, I think there is one more. Yeah. Now, what are the steps? In conducting systematic review, create a review protocol. First thing, that is inclusion criteria. Study selection. Pick relevant studies based on review protocol. Collect data from each selected study. You see, somebody did a job and we are going to do over and above in a systematic review. If you are in a team of systematic review committee, you have to take care of all these steps. Then document the method by writing a review, report, or article. Next. Okay, so once you create a protocol, you find out what are the studies in the literature. Okay, after that, once you select a study and then critically appraise the quality of studies, then you go with the data collection and then you synthesize and summarize the findings from included studies. That is a inclusion criteria. Then document the results. Next. So now coming to important step again, what is a protocol? So once you develop a protocol, then only you can get into the system. Okay, so a protocol is a set of rules and guidelines for communicating the data. Then protocol is a system of rules about the correct way to act in an informal situation or in a formal situation. Protocols differ in various situations. Example, for medical studies, different, law, different, IT, different, engineering, different, Air Force, political powers, etc. So every area has to have their own protocols. Nursing have to have their own protocols. Hospital have to have their own protocols. Colleges, educational institutions should have their own protocols. So these are the areas we have to develop very carefully. Next. Okay, click please. What are the principles in developing protocol? Number one, summarizes and synthesizes existing studies. First thing, first principle, to summarize. Then to understand knowledge. Then make objective assessment of primary research and with evidence. Primary research, that means already done researches. We are selecting some studies and then trying to develop a protocol, then to go for systematic review. This is the meaning. Then various decision making matters. So based on all these, the decision making will be done. Okay, next. Okay, next. Please click again. How are the reviews related? How will you select? How will you place them? How will you segregate? Previous slide, please. Yes. Here, all review. First thing, major part is all reviews, the literature reviews you have to select. Then you pool them for systematic review with a specific criteria. Then comes meta-analysis. So once you specify the criteria and select from the pool of studies, then go for analysis. Next. Next, please. Differences now to understand. Literature review is summarizes a topic that is broad in scope. Okay, for example, cancer treatment and qualitative studies. Okay, then systematic review means answers a specific clinical question, whether following PICO format. Example, is vitamin C or chemotherapy a better cancer treatment in patients over the age of 40? Okay, so which are the areas you will do what kind of review? Next comes defines a specific search strategy, that is list what will be included and excluded in the article selected. So inclusion and exclusion criteria you need to develop. Meta-analysis, look at studies from a systematic review point. The purpose is it combines similar studies and pulls data to get a statistically significant results. Okay, next. Next, please. Now, how to organize your data, your review articles, and for identifying the evidence. Okay. First thing is the levels of literature. Hello? Hello, can you hear me?
Yes, ma'am, we can hear you, ma'am.
Okay, okay. Sorry for interruption. So you see the two levels. Okay, one is unfiltered information. That means three levels are there. Number one, the base, background information with your for expert opinion. Collect as many number of articles as possible, depending on the question that you want to investigate, depending on the criteria that you have identified, selection criteria, inclusion criteria. Next comes what kind of studies you want to take. That is, whether you want to go with a case control studies or case series or reports. Okay, then comes cohort studies. So what level of studies that you want to review? So that is what you have to understand. The next is randomized control trials. So the more higher up you are trying to scrutinize systematically to come to one kind, then the top unfiltered thing is the studies, different kind of studies. RCTs are to be also reviewed. If you have any queries to be answered before you make decisions. Now, how will you filter the information from these studies, these kind of studies? So we said background information you got, expert opinion you got, different kinds of studies you selected, okay? And then critically appraised individual articles. You critically appraise That means every kind of studies to be appraised. And then the article synopsis should be formed. Then critically appraised topics. First studies, then topics. Whether diabetic mellitus with what kind of diet or exercise, whatever, or hypertension with some food control or lifestyle modifications. Okay, because risk factors are there, modifiable, unmodifiable risk factors. What exactly you want to study? Or is it a immunization related, vaccination related? What exactly you want to appraise by topic? Okay, by articles, then by topic. Then comes systematic review at the top. After filtering, you are coming to the highest level of filtration, that is where exactly you want to review to arrive at decision making. So this is how you have to find out the evidence. Okay, levels of evidences, how to pool and how to filter and go up to critically analyze. Next. Then for the rational, please click. Please click the slides. Please share the slide, please. Okay, sorry for this customization. A rational for systematic review. One is to inform medical decision making. So we have come to you have seen the pyramid. Okay, the top, the crucial thing, inform medical decision making with the results, evidences. Plan future research agendas when it is needed. How it is when we are really need. Then establish clinical or health policy. The government or the agency should make a policy. Then possible use for comparative effectiveness of research. So these are the areas that systematic review is to be used. This is the rationale for using the systematic review. Next. So once again, I'm repeating this, sharing this slide. First step is to inform medical decision, then go on. Now, limitations. What are the limitations? Still, even every general research also, basic research also have limitation. In this also limitations are there. First of all, they encounter the same pitfalls as primary research. They means the team. The team who is going to do this systematic review. It is not a single person who is going to do systematic review. The experts must come to the team. Experts should be pooled. That's what it will come in the protocol development. Who will be in the team for the systematic review? So they encounter the same pitfalls as a basic research, primary research. Repeatability, bias, appropriate uses of methodology and statistics. Maybe again we'll be doing the same or need to do the same. Small effects of interventions may be magnified. Maybe sometimes it has to be exaggerated. It can be exaggerated. SRS are difficult to find or execute when evidence is scarce. That means when there is no evidence, you can't find anything literally, or even after searching everything, you could not arrive at any decision making. Okay, you couldn't find any evidence, then it is not beneficial. Any systematic reviews do not show the protocol used, because this is again pitfall. There should be a definite protocol to be prepared before you attempt to do the systematic review. Then questionable validity, reproducibility, considered as a being wasteful use of time and resources if poorly done. What is wastage? Waste of time, waste of energy, waste of resources, waste of money, everything. because at the end, you could not arrive at any conclusions. Okay, these are all limitations of systematic review encountered, can be encountered. Okay, next. Next, please. Next, please. Next slide, please. Next slide, please. Okay, now, how to develop a review protocol? Most important, its application of systematic review. One is background of the study. There are few steps. One is background, purpose of the study, objectives or review questions. Why, what is the purpose of reviewing these studies? Methods to be followed, research strategy, data collection, and next. Here in third point, selection criteria. Where you need to concentrate on type of intervention, type of outcome, population of studies, and then type of studies, type of publications, publication date, language, location, all these are to be taken care. Next slide, please. Then displaying us data. Now, how to apply? The Prisma flow diagram is an example. Here, there are some steps. Records identified through database searching. Here, additional records identified through other sources. In a primary research, we also have a literature review. Here, what we want to say is records are identified through database. Already, we selected. If you remember the pyramid that I have shown. And then, in addition, you have to have additional research literature for supporting. Then records after duplicates removed. Next step, the number of records after search, which are all duplicated records, are to be removed. Then records screened, number of records screened, then full text articles assessed for eligibility. See, all number of full articles, full studies. Okay, number of studies included in a qualitative synthesis. Okay, when it comes to additional, you need to have number of records excluded and number of full text articles excluded with the reason why you have excluded, why this is not needed. Okay, so in this way, you are systematically selecting the number of studies for review. Next. Most commonly used format is PICO format. That is population to be studied, or patients, or problems, or number of the articles. How would you describe a group or patients similar to yours? Okay, then I is interventions or prognostic factor or exposure, which main intervention, prognostic factor or exposure are you are considering. Which one we are considering? Then C is comparison. What is the main alternative to compare without intervention? Then outcomes. What can you hope to accomplish, measure, or improve, or effect? So this has to be formulated appropriate to the systematic review. Okay, among whom, whether this intervention is comparatively okay, effective, and what is the outcome, what are the results. Okay, this is the PICO format. Okay, next. And then there are some components in the proposal of research review, systematic research review. One is problem identification, justification of the project, goals, study questions or hypothesis, study design, methods. Next. Analysis plan, plans for interpreting the data, plans to report study findings, budget required, time required, and any appendices to attach. Next. Next, please. Now, one by one, if you go through, problem identification. Why problem requires a study? Discrepancy, if any discrepancy is seen between the real and the observed situation and the desired situation, then that is the alert. We are alerted that their systematic review is needed. There is something wrong. Really threatening, life threatening. Okay, so every now and then the government is alerting that keep all the hospital beds ready, keep oxygen ready, this is ready, that is ready. And how really is it? Many people started asking, is it really a life threatening a problem, COVID? Okay, this is a problem identification. Next. Justification of the project. When you go for systematic review, what is the justification? What is the reason? Justification means reason. Describe what you want to study and why. Relevant questions to address might include, is the problem current and timely? Is it a life-threatening? Does it affect many people? Is it a concern by many different people? Have other studies already addressed this action, this problem? Organize this section into a few concise paragraphs. So these questions to be answered in a paragraphs. Next. Set the goal. Broad statement of the problem and purpose. Describe the results to be achieved and how you will achieve them. Develop a SMART objective. You know, SMART objective, what is that meaning? Okay, next. Fourth proposal component is a study question, hypothesis, an explicit statement of what will be investigated. Study design.
Excuse me, ma'am. Very sorry for
my time is up.
you. Excuse me, ma'am. Very sorry for disturbing you. The person who is sharing the screen, can you please stop and reshare? Someone has scribbled. Please, delegates, don't scribble the screen and make the screen untidy. You are all very professionals. Please don't do this, please. So please, who is sharing the screen, please stop sharing and again reshare it. Who is sharing the screen now?
Yes, sir. Yes, sir.
So please stop the sharing and again you reshare so that the scribbling will go off. Yes. Sorry, ma'am. Very sorry for the interruption.
I thought, why in between these things are coming?
Yes, very sorry.
It's okay.
Very
Thank
sorry. You can continue.
Thank you, Dr. Bino. So the question, study questions and the study design have to be described. Okay, describe your study design. Next. I'm coming to the end. Sixth component is methods. Specify your study population, describe the type of data you will collect, describe your data collection procedure, identify data quality procedure. See here, one more thing, quality procedure is there. Then describe partners you will collaborate with. Who are your partners in the team? So here the method is a little bit different than the basic research. Analysis plan, include a few key table shells that show how you want to organize your data. Okay, next. The eighth plan, eighth component is plan for interpreting the data. Describe the population to which you can generalize the results. Identify the limitations of the study. Then plans to report study findings, discuss how you will disseminate your results. Budget, provide an overview cost of your study. Organize the cost items by salaries, by supplies, by equipments, travel, miscellaneous cost. So because it is not a single-handed research study, it's a group, it's a team, team of experts who are going to do this systematic review and meta-analysis and publish the results. So budgeting is very important. Next. timeline, how long you would like to take for publishing the results from your research review, for your systematic review. Whether government is asking you to produce in 3 months, 6 months, 1 year, what time frame you have to make. Okay, then appendices, whatever supportive documents or checklists or whatever you are attaching for further investigation, it should be appended. Okay, so these are the 12 components that are needed for protocol development and doing the research systematically. Okay, next. So this Prisma checklist is developed. So there are 15 points, whether your systematic review is going in order or not. So you can go through this later. I don't want to read. Everybody will get bored. Okay, but just outline is there. Title, abstract, introduction, methods. Okay, under methods, more details, whatever I have shared. And then the risk, the summary, measures, then the final thing you have to produce. Okay, so this checklist must be applied. Next. Some articles I have taken, one of the articles, how they do systematic review. There are lots you can do at our leisure time for self-learning. So the determinants and consequences of adult nursing staff turnover, which is the burning issue everywhere. We are still short of staff. Systematic review of systematic reviews. So you identify all the reasons. Many don't give the exact reason why they are leaving the institution, why they are not happy with the nursing practice, nursing teaching. Many shifted off from the nursing profession itself. They became somebody different, IAS collectors or health educators or nutrition. I mean, at least I know a few of my friends changing the profession. Okay, next. So I have come to the last part in the systematic research reviews. You need the confidence. Confidence doesn't come when you have all the answers ready-made, but it comes when you are ready to face all the questions and challenges. It challenges you. So one should be ready to take up the challenge, not to get scared and then, no, it's a big headache, I can't do this. Okay, next. This is the take-home message, and to conclude my topic and my discussion, systematic review allows rigorous, impartial, I'm insisting on this word, impartial and literature-wide assessment and quality of designs. You have to be very careful. Poorly conducted systematic review can mislead, just like any other experimental studies. A vague question is likely to lead a vague answer. On literature search, care needs to be taken to ensure that all relevant data is obtained. A meticulous search must be coupled with meticulous record keeping, be able to criticize the quality and limitations of the literature in the view to improve future study design. Consider what novel findings your review brings to the literature. Okay, okay, next. Hope you have got something out of my presentation. What is systematic review, why it is needed, how to do it, and then what is the importance of meta-analysis and who should be doing this. Okay, from basic research. Thank you, and it's a challenge. Those who like challenges will like the novelty and they'll keep doing the best. Thank you for the time.
Thank you so much, ma'am, for such a knowledgeable session. Thank you, ma'am.
Thank you.
Moving to the next, it is my pleasure to introduce our next moderator, Professor.
Sorry to
Yes, sir.
interrupt you. Very sorry to interrupt you. I request Sister Tessie, ma'am.
Yes,
Sister Tessie.
sir. I'm here ready.
Yes.
Yes.
Yes, sister. You can just have a means Any participants, any questions are there? Just you can see, sister.
So, Madam Rebecca had summarized very systematic way itself, and it was very informative way she complied and given to us the nutshell in the oceanic topic of this systematic. We can have it now. Any doubts or any questions, please.
We can go on with many examples, but the time won't permit. We can our whole day also we can speak. So lots are there, but I try to put it in a nutshell to understand the meaning of systematic review, which is over and above the basic research.
It was a systematic review and you put it before us in a systematic way. I would like to just to say about that one comment, like please, the topic is like oceanic and it is concise, like a chirpy, melodious stream to every learned people.
Thank you, Sister Tessa.
Thank you very much. Thank you very much.
Thank you. Thank you. Thank you all. If there are no questions, then I think I can leave.
Excuse me, ma'am.
Yes.
Ma'am, when we do the analysis,
yes.
So we had a systematic review.
Definitely, that's what I said in the beginning. The protocol should be well developed. What questions to be answered? What is your research question? Why you are conducting systematic review? So your question should be answered in your analysis. That is the result.
Okay, only based on our criteria, we can go on inclusion and exclusion.
Definitely. Even basic research, see the title, from title, you have to go with the purpose, then with the objectives. Okay, a statement of the problem, of course, we have a particular way of stating, but with the research question, objective, hypothesis. Then you are going to analyze after data collection. The data collection procedure is very important. Every minute details to be addressed. Then only the results will be with the evidences. The clarity will be there. Otherwise, you cannot get good results when there is no clarity and your generalization, everything will be misled. That's what I said in the limitations. It will be same as your basic research, primary research. Finally, at the end, we are going to, it will be wasteful of time, energy, money, everything. Got my point? So there is no particular thing. Analysis depends on your objectives or your research question. Whether my research question is answered at the end of my analysis. That is the decision making to report to whichever authority has engaged you, permitted you to carry out research review, systematic research review. Maybe for South India, you want to see the study on COVID vaccination impact or efficacy or the incidence and prevalence rate, how many are affected or how many deaths. Then the representations, the top officials who are experts from Karnataka, Kerala, Andhra, and Tamil Nadu, which is considered as a South zone. Then these people have to have all the details, pulled together all the data from all the states, analyze. I said in the pyramid, the basic literature, then from important studies, case control studies, then RCTs, okay, case series, everything should be analyzed. So that's why protocol development is very important.
Okay, ma'am. Thank you so much.
Thank you. I hope everybody got it.
Thank you, ma'am.
Yeah. Thank you. Anything else? Thank you, Dr. Alka and Dr. Binu and Dr. Bimla Kapoor and all the organizing team for giving me this time and for bearing with me to listen to my topic. Hope I try to make it simple to understand for the delegates. Thank you.
Thank you, ma'am.
Thank you so much, ma'am.
Sister Tessie, thank you very much for moderating.
Thank you very much.
Okay. Can I leave?
Yes, ma'am.
Thank you.
Thank you. Moving to the next session, it is my pleasure to introduce our next moderator, Professor Dipesh Bhardwaj sir. Professor Dipesh Bhardwaj sir is Associate Professor in Pediatric Nursing in Mahatma Gandhi Nursing College in Mahatma Gandhi University of Medical Science and Technology, Jaipur, Rajasthan. Sir has done his Bachelor Nursing from the SGK College Nursing in Gwalior from the Jivaji University. Sir has also completed his Master in Child Health Nursing from the KS Nursing College, Gwalior. Sir is a PhD scholar in Mahatma Gandhi University of Medical Science and Technology, Jaipur, Rajasthan. Sir working as Associated Professor in Mahatma Gandhi Nursing College, Sitapur, Rajasthan. Sir works as a lecturer in a Pink City College in Nursing, Gujarat. Sir served his work as a lecturer in Symbiosis College of Nursing, Jaipur. Sir worked as a nursing tutor in Irshad Memorial Institute of Nursing Education, Jaipur. I would like to invite Sir to direct the further session and introduce our second speaker, Professor Vaishali Taksande, ma'am. It's over to you, sir. Thank you.
Thank you, ma'am. Can you listen me?
Yes, sir.
Good afternoon, all respected dignity, and especially thanks Alka ma'am, Binu Joy ma'am, Binu Joy sir, and Mansu sir to provide this opportunity. So today the second session we will be start to introduction of Madam Professor Vaishali Takshande. She is the professor and vice principal Srimati Radhika Bai Megi College, Bardha in Maharashtra. Ma'am have more degree in nursing, and he was started the first as a staff nurse, Cancer Hospital and Research Institute in Gwalior. After then, the nursing tutor, Maharashtra Nursing Council, and nursing tutor, FNTCN, Swangi Megi Bardha College, and lecturer, Srimati Radhika Bai Megi, Memorial College of Nursing. And she has worked as Dean and Academic Faculty of Nursing, DMIMS, DU, Swangi Megi, Bardha, Srimati Radhika Bai Megi Memorial College. Ma'am had BSc Nursing in Jivaji University in Gwalior and MSc Nursing in the branch of Obs and Gynecological Nursing in SNDT Women University, Mumbai. And now he PhD scholar in going Datta Megi Institute of Medical Science, deemed university, registration done in 2019. And she is the working presently vice principal Srimati Radhika Bai Megi Memorial College of Nursing. Ma'am have published many papers in national and international journal. She is present scientific paper in national and international level. She is the resource person in various national and international conference. Ma'am is membership in 10 Nursing Association and Society of Midwife in India. So today I will introduce Madam with the topic of sampling and sample size and determination. To welcome Ma'am, Professor Vaishali T. Takshande.
Thank you so much. I am audible?
Yes, ma'am.
Yes, ma'am.
Can you able to my slide?
Yes, ma'am.
Okay, thank you so much. Thank you so much, Dr. Dipesh Bhardwaj sir, for giving us such a small introductions. So today I am going to talk about the sampling, and sample size determination. 1 minute. It is visible?
Yes, ma'am.
Okay. So these are the some specific objective after the end of session. We can discuss the some terminology of sampling, then purposes of sampling, then enlist the characters of the good sampling. There are the different stages of sampling. There are the factors influencing sampling process. Describe the types and sample size determination and what are the sample errors. So before going to the these things, we have to go some terminology. That is the population. First, we have to go regarding the population. Population is a collection of all unit in which a researcher is interested. Population, it is a set of people to which result of research are to be generalized. For example, a researcher need to study the population faced by the PG nurses in India. So here the population are the PG nurses of India. This is a population. So it is a collection of all unit in which the researcher are interested. Second one is a target population. Target population consists of a total number of people or object which are meeting the designated set of criteria. So that is called as the target population. For example, if we say identifying the complication of COVID-19 among the people who have diabetes type 2 in Wardha district. So in this target population are all the diabetes mellitus type 2 suffering with the COVID-19. So these are the targeted population, the total number of people or object which are meeting the designated set of inclusion and exclusion criteria. Next is a accessible population is the aggregate of the case that conform to designated criteria and are also accessible as a subject for the study. So for example, if we say a study on the registered nurse working in the Acharya Vinoba Bhave Rural Hospital, Wardha district. So in this case, regarding some knowledge, so in this case, the population of this study is all the registered nurses working in ABBRH hospital, but some of them may be on leave or may not accessible for the research study. So therefore, the accessible population of this study is registered nurse who meet the designated set of criteria and who are available at the time of research study. So that is called as a accessible population. Next is sampling. It is a process of selecting the representative segment of population under the study. So sampling, it is a refer to draw a subset from a population to the full set. So that is called as a sampling. It is a set of element taken from the large population. That picture you can see, these are the population and we are taking some sample for our research study. So this is the sampling. Now we can go for the purposes of research. Purposes of research, purposes of sampling, it is a economically. First purpose is economically. It is a not possible and economically for the researchers to study the entire population. So with the help of sampling, the researcher can save the time and money. Second is a improve the quality of data. So it will help to, it is proven fact that when a person handle less amount of work, then it is easy to ensure the quality of outcome. It is easy to maintain the quality of research work, which could not be possible in entire population was involved. So the quality, improve the quality of data should be there. Then the quick study result is there. It is a third purpose of the sampling, quick study result. Studying the entire population itself will take a lot of time. Generating the research result of a large is very difficult to the limited time bounding. But with the sampling, it is possible to generate the study result faster, which one of the important objective of every researcher. So if we are going for the sampling, we will get the quick result, study result. And accuracy of the data should be there. It is always easy to establish better rapport with the sample. If we sample we are taking, and we can able to maintain the accurate communication with the sample, and thus to collect more accurate data, and we will get the accuracy of the result should be there. So these are the some purposes of the sampling, that is economically it is very beneficial, improve the quality of data, then quick study result is there, and accuracy of the data is maintained because of the sampling. Next one is there are some characteristics of the good sample. In the characteristics of the good sample, there is a representation. They are free from the bias. There is no substitute and incompleteness, and appropriate sample size is there. So representation means a representation of sample make it possible to generalize the finding of the population. So everything there should be the representation should be there, so we can generalize our findings. The free from the bias and error means a good sample is one which free from the bias and the error of the subject of the study population, and the sample should be free from the simple random sampling error as well as the sampling the bias. The next characters is a no substitute and a incompleteness. So whenever we are taking the sample, the sample should be the no substitute, means we have to take the complete pre-test, post-test and everything. If he is living in between, so we have to drop that sample, and it should be complete sample should be there. So no incompleteness is there. Then appropriate sample size should be there. Whenever we are conducting the any study, the size of the sample should be the appropriate. In quantitative study we have to take more sample, and in qualitative study we have to go for the less sample. So these are the some characteristics of the good sampling whenever we are going for the sampling. Next is the sampling process. There are some stages of sampling process. First is identification and define the target population. First we have to go for the identification and define the target population. This is the first stage of the sampling process. Second is describe the accessible population and ensuring the sampling frame. Then we have to decide what is the accessible population who are meeting the inclusion and exclusion criteria in this study, and then we have to prepare the list of the participant, that is called as a sampling framing. Okay, after that we have to specify the sampling unit. We have to establish the sampling unit by inclusion and exclusion criteria particular sample. Then specifying the sampling selection method, then we have to identify which method is very effective for the collection of the data. So we have to identify the sampling method. Then determining the sample size, then we have to check the how much sample size should be there. Means it depend upon the which type of research design we are using, as well as which type of the research we are using, and whether it is a population based study or whether it is a testing for the hypothesis. So depend upon that we have to select the sample size. Then specifying the sampling plan, and then select the desired sample. Then we have to select the desired sample of these things. So these are the some stage of sampling process. After that we have to see the what are the these things, the factors. Then there is a, we can able to see the factors influencing the sampling process. So there are some factors which is responsible for the sampling process. First is a nature of researcher, means we can able to identify because of the nature of researcher, these are the some factors is responsible for the sampling process. That is inexperienced investigator. If the inexperienced investigator is there and he is not having any experience how to collect the data or how to collect the sample, then there is a naturally we will get the defective result. Lack of interest, that the students are not taking the interested topic, and because of the force of guide if he are taking the research, and because of that he is not able to honest in the particular things to collect the data at the research process, and we will get the defective result. inexpensive workload, and if the researcher is having the inexpensive workload, so he is not able to concentrate their particular thing, and because of that we will not get the proper result. Inadequate supervision is also lead for the these things, means the students will not get the proper supervision how to conduct, which is a pico format, as madam is explained very nicely. All these things, if the supervision is not there, so naturally there is a effect of the these things. Then nature of sample. Nature of sample is also influencing the factors of the sampling process. For inappropriate sampling technique, if the sampling technique I am not using proper in my research, so naturally it will affect the result. The sample size is also very important whenever we are going for the research, and if it is not taking properly, so we cannot generalize our findings in the particular things. Then defective sampling framing, means we are not preparing the list of the sample very properly, and because of that there is a inappropriate result will be taken place. There are the other responsible factors like lack of time. The researcher is not having the time to conduct the study properly, and because of that we will not get the proper result. Then large geographical area, because of the population is very large and the researcher is not having the resources to go the cover the large population. Then lack of cooperation, it is not there. And the natural calamities, like now we are having the COVID-19 pandemic, so our PG students is not able to collect the data from the school, because their sample are from the school students. So because of the closing of the school, they are not able to take the sample from the school. So they are approach the authority and they are finding the online technique to collect the data. So these are the some factors which is responsible for the sampling process. So nature of researcher is responsible, nature of sample is responsible, and other circumstances issues. Next is a type of sampling technique. So this is the next topic. These are the two type of sampling technique: probability sampling technique and non-probability sampling techniques. We have to see detail in the probability and non-probability sampling technique. Probability sampling technique, it is we are having the different type: simple random sampling, stratified random sampling, systematic random sampling, cluster or multi-stage random sampling, and sequential sampling. And non-probability sampling technique, it is having the purposive sampling, convenient sampling, conservative sampling, quota, and snowball sampling. So here we will see one by one. First we will see the probability sampling technique. Means what? It is a based on the theory of probability. It is a based on the theory on probability. It involves random selection. It involves probability, means it is a random selection we are going, and every subject in the population has equal chance to be selected as a study sample. So whenever all population has an equal chance to select in the study, and the chance of systematic bias is less because subjects are randomly selected, because the subjects are randomly selected. It is a first type is a simple random sampling. It is the most basic type of random sampling. Remember, in every sampling frame has equal chance to being the final population, final sampling. The first steps of simple random sampling is to identify the accessible population and prepare the list of elements, member of the population. The list of the subject of population is called as a sampling frame. So simple random sampling, everyone is sampling frame is having the equal chance of the sampling process. So there is a sample drawn from the sampling frame by using the following method. So everyone know that lottery method we are using very frequently. Then use of table of random member number, and the use of computer. So lottery method, we are making the chit, and we are keeping in one bowl, and then out of that we are picking one things up to the our sample size. We have to find out the how much sample size is there. Use of table of random method, we are making the rows and column in the number, and we have to select the which we have to select the number. And nowadays we are having the we are using the computer to we are giving the command to the computer and identify the our sample size. So these are the different method to collect the simple random sampling. Next, it is a merit and demerit. Merit of simple random sampling is easy to assemble the sample. Simple random sampling, it is easy to assemble the sample. Fair way to selecting the sample. Required minimum knowledge about the population in advance. Whenever we are going for the sampling, we require the minimum knowledge about the population in advance. Unbiased method, because everyone is chance to select into the study, free from the sampling error. And demerits are required a complete and up-to-date list of the members should be required, because everyone we have to include it and everyone is having the equal chance. Lot of procedure need to be before sampling is accomplished. Means before doing the sampling, we have to make the list. We have to find out whether the list is complete or not, and then we have, if we are using the lottery method, then we have to prepare the list and all these things. So a lot of procedure needed to be done before the sampling accomplished. Then extensive and time consuming process, because of to prepare the list and all these things. So it is an extensive and time consuming method. So this is a simple random sampling. Next, it is a systematic random sampling. Next, it is a systematic random sampling. First, determine the simple sampling interval. In systematic random sampling, first determine the sampling interval, which is symbol by K. The population size divided by the desired sample size. So here we have to identify the sampling interval, which is symbol by the K. Second, we have to find out randomly selected number between 1 and K and include that person in your sample. And third one is also include each K element in your sample. So for example, if the K is 10, for example, my K is calculated 10 and you randomly selected number between 1 and 10 is 5. Okay, then you will be elected person 5. Then next is the 15, because 10 gap is there, so 15, then 25, 35 and go on. So that is called as a systematic random sample. That is called as a systematic random sample. Here we have to identify the sampling interval, which is symbolized by the K, and then randomly selected a number between 1 and K, and then that person is also you are included into the sample, and also each K element of the sample is involved in your study. So this is an example. Now merit of this systematic random sampling is, it is a simple convenient technique to carry out of the sample process. It is a sample is spread evenly over the entire given population, because we are using a systematic interval. So it is a evenly over the entire population we are covering. And demerits are, it is the first subject is not randomly selected. Then it is become a non-randomized sampling technique. Whatever the K we are selecting, and out of that K, first sample we are selecting by choice of the researchers. That's why it is a not randomly. Sometimes this may result the bias sample also. This may lead to the bias sampling also. So this is a systematic random sampling. Next, it is the stratified random sampling. Stratified random sampling is entire population divided into different homogeneous subgroup or strata. So that is called as a stratified random sampling. So here we have to entire population divided into different homogeneous subgroup. And these strata are divided according to their trait of the population, such as age. It depend upon the age, it depend upon the gender, it may be the religion, it may be the education type, it may be the which type of the registered nurse, whether it is the GNM, BSc, like that. So we have to make the homogeneous strata or the subgroup. That is called as the stratified random sampling. This stratified random sampling further divided into two groups, that is the proportionated and disproportionated. So proportionated Proportionated stratified random sampling. In this sample, the subsample are proportionated to their size in the population. For example, if my strata is a gender, so 50 male I am taking and 50 female I am taking. So this is a proportionated stratified random sampling. This proportionated stratified random sampling is the sample. The subsample are not proportionated to their size in the population. Whatever the subsample we are collecting, they are not proportionated to their size in the population. So for example, if gender is my strata, and out of 25 are male and the 75 are the female. So these are the disproportionated stratified random sampling. So this is the stratified random sampling, proportionated and disproportionated sampling technique. Now next it is a cluster random sampling. Cluster random sampling, this technique is done when simple random sampling is almost impossible because of the sample size of the population. If the sample size is too large, so simple random sampling, it is not possible. So we have to go for the cluster random sampling. It means random selection of sampling unit consisting of population element. Then from each selected sample unit, a sample of population element is drawn by either simple random or stratified random sampling. Example, a researcher want to survey the academic performance high school students in India. For example, a researcher want to survey academic performance of high school students in India. So he can divide the entire population of India into different clusters, that is the cities, and then select the number of clusters depend upon his research through the simple or systematic random sampling. He had to select the cluster dependent on his simple or systematic random sampling. Then the selected cluster, that is randomly selected cities, the researcher can either include all high school students or he can select number of subjects from each cluster through simple or systematic random sampling. So in this way, he has to go for the systematic cluster sampling. So cluster is having the different types, one stage cluster and two stage cluster. In previous example, in this technique, sample occur when the researcher include all the high school students from the randomly selected cluster as a sample. So that is a one stage cluster. If we are selecting all the high school students in one cluster, so that is a one stage cluster. And two stage cluster, in this technique, the sample obtained when the researcher only select a few number of students from each cluster by using a simple or systematic random sampling. So that is a two-stage cluster sampling. There are some merit and demerits of the cluster sampling. Merit are, it is a cheap, quick and easy for the large sampling. Some cluster can be used for the other studies also if we are using the same setting of the data collection. So same cluster, whatever prepared in previous study, same cluster we can use for the next studies also. Demerits are, it is a homogeneous population is used, homogeneous population is under study, and this technique is not at all useful. It is a small homogeneous population if we are going, so it is very difficult to use the cluster sampling. So whenever we are going for the large study, we can go for the cluster sampling. Next is the sequential sampling. Sequential sampling, it is a sample size is not fixed. Whenever we are going for the sequential sampling, the sample size is not fixed. The researcher initially selected small sample and try out the make inferences. If not possible to draw the result, he or she then add more subject until clear cut inferences can be drawn. So it is a not fixed sample size. And the researcher study, for example, a researcher want to study the association between the smoking and the lung cancer. So initially researcher take a smallest sample and try to draw the inferences. If unable to draw any inferences, he or she continue to draw the simple sample until the meaningful inferences can drawn. So, for example, if the researcher want to study the association between the smoking and the lung cancer, so he has taken only small sample. And then again he unable to draw any inferences because of that small sample, then he has to increase the sample size until the meaning of inferences are drawn. So this is an example. First, she has taken the 20 sample only. Out of 20 sample, 7.
മാഡം ബയോഫിസിക്സിനും ബയോകെമിസ്ട്രിക്കും സെപ്പറേറ്റ് അല്ലേ? അതുകൊണ്ട് രണ്ട് ചീഫ് ഡയറി അല്ല.
So out of 20, the smokers are 7 and 30 and 13 are non-smoker, and out of 7, the 2 are having the lung cancer, and out of 13, 1 is having the cancers. And then again she increased the sample size up to the 50. Then we are getting the inferences that 10 are having the lung cancer, or those who are doing the smoking, and the 4 is not having the lung cancer, those who are not doing the smoking. So that is called as the sequential sample size. The merit of this is a helping in ultimate finding the inferences of the study, and the demerits are it is not possible to study a phenomena which need to be studied at the point of time. That is called as a demerit in the sequential sample. Next, it is a non-probability sample. Non-probability sampling, in this technique, the sample are gathered in a process that does not give all the individual in the population equal chance of being selected in the sample. So in this technique, the sample are gathered in a process that does not give all individual in population equal chance. So random selection probability means every individual is having the equal chance, but here does not have the equal chance of the enter into the population. That is a non-probability sampling technique. Non-probability sampling technique, the features of this non-probability sampling technique are, in this technique, the sample are gathered in a process that does not give all individual in the population equal chance being selected in the sample, and the sample may or may not represent the entire population accurately. Therefore, the result of the research cannot be used in generalization pertaining to the entire population. So this is a very distinct drawback of the non-probability sampling technique. The type of the non-probability sampling technique, first we have to see the purposive sampling. In purposive sampling, it is a commonly known as a judgmental or authoritative sampling. The purposive sampling, it is also called as a judgmental sampling. The subject are choose to the part of sample with the specific purpose in mind. We are having some specific purpose in mind, and for that purpose, we are selecting the purposive sampling. In this technique, sample are chosen by choice, not by the chance. So it is a chosen by choice, not by the chance. And for example, a researcher want to study the live experiences of post-disaster depression among the people living in the earthquake affected area of Gujarat. So in this case, a purpose of sampling technique is used to select the subject who were victim of earthquake disaster and those who are suffering with the post-disaster depression living in earthquake affected area of the Gujarat. So this is my purposive sampling. If I want to study the live experience of the post-disaster depression among the people, those who are living in the earthquake area in the Gujarat, so my sample is a purposive sampling because those who are victim of earthquake disaster and those who are suffering the post-disaster depression and living in the Gujarat. So for that type of the study, we have to use the purposive sampling. Merit of the purposive sampling, when limited number of individual possess the trait of the interest, the sample to draw, simple to draw the sample, and useful in explorative study. If your study type is explorative, so it is very useful and required the less field work. Demerits of the purposive sampling required a considerable knowledge about the population. The researcher has to knowledge regarding the population, and it is always not the reliable sampling. It is not always it is a reliable sampling. So this is a purposive sampling merit and demerit. Next, it is a convenient sampling. Convenient sampling, it is a fast, inexpensive, easy, and the subject are readily available. It is in these subjects are selected because they are convenient, accessibility and nearness of the researchers. Why we are taking this sample? Because it is a convenient to the accessible and nearness to the researcher. It is also known as a accidental sampling. It is also known as a accidental sampling, and subjects are chosen simply because they are easy to recruit. Why we are taking this convenient sample? Because subjects are very easy to choose, because it is a easy to recruit, because the researcher is having the easy to recruit that particular sample. That's why it is called as a convenient sample of researcher. For example, if the researcher want to conduct the study on older people residing in Ludhiana, and the researcher observed that he meet the several older people coming from the morning walk in the park. So because of the convenience of the researcher, he is just selecting particular sample. So that is called as a convenient sample. Merit of this, it is the cheapest, easiest and least time consuming. It help in saving time, money and the resources. The demerits, it is a simple sampling bias is there, because it is a choice of the researchers. He is just selecting the sample. It does not provide the representative sampling from the population of the study. So this is the biggest drawback of this particular sampling technique. Next is the consecutive sampling technique. It is very similar to the convenient sampling, except that it is seek to include all accessible subject as a part of sample. It is just like the convenient sampling, but the difference is that it includes all accessible subjects as a part of sampling. It includes all the subjects that are available, which make the sample is better representation of entire population. So better representation of entire population must be there. It is also called as the total enumerative sampling technique. It is also called as the total enumerative sampling technique. In this technique, pick up all available subjects who are meeting the preset inclusion and exclusion criteria. So all accessible population we are included, those who are meeting the criteria of inclusion and exclusion criteria. So that is a consecutive sampling technique. Example, a study of the activity, if we want to study the activity pattern of post kidney transplant patient, he can selected all post kidney transplant patient who meet the designated inclusion and exclusion criteria and who are admitted in a post transplant ward during the specific time period. So that is a consecutive sampling technique. If you want to study the pattern of post kidney transplant patient, so all selected post kidney transplant patient who meet the inclusion and exclusion criteria and who admit the particular ward in specific time period or during the time of data collection. If the patient is available, he has to take all the sample. Merit of this, it is a not expensive, not time consuming, ensure more representation of the selected sample than the convenient sampling. And demerit is no set plan about the sample size and sampling schedule is required, and it cannot be used to create conclusion and interpretations pertaining to the entire populations. So this is the merit and demerit of the sampling technique. Next, it is a quota sampling. Quota sampling, in this the researcher ensure equal or proportionate representation of the subject depend on which trait considerable as a base of the quota. The base of the quota are usually, it is a age, it is a gender, education, race, religion. So you can make the quota with the help of age. We can make the male or female quota, education, race, religion, etc. For example, quota in a college level, the researcher need equal representation with the sample size of 100. For example, my sample size is 100 and I have to make the quota sampling. So he must select 25 first year students, 25 second year students, 25 third year students and 25 fourth year students. So year wise quota has prepared. So that is called as a quota sample. So quota can be prepared as a homogeneous age, gender, education, race, religions, anything. Merit of the quota sampling, it is economically cheap as there is no need to approach all the candidates. And the demerits, bias is possible as investigator can select the person known to him. So that is a demerit of the quota sampling. Next one is a snowball sampling. Snowball sampling, in this identify the potential subject in a study where the subject are hard to locate, such as the commercial sex workers and the drug abusers. So where we are not getting the subjects in very difficult, we are not locate that particular subjects. So in that condition, you can go for the snowball sampling. Example, if you want to do the some study regarding the commercial sex workers or the drug abusers, so we can go for the snowball sampling. This technique work like a chain referral. This technique is work just like the chain referral. It is also known as a chain referring sampling. Example, a study on prevalences of HIV/AIDS among the commercial sex worker. If my study, it is we have to identify the prevalences of the AIDS or HIV among the commercial sex worker. So I can use this type of the sampling. The process of snowball sampling is much like asking the subject to nominate another person with the same trait. We have to find out first person and then we have to ask them like asking subject to nominate another person with the same trait. The researcher then observe the nominated subject and continue in some way until the obtaining the sufficient number of the subject. So that is called as a snowball sampling. So there are the different types of the snowball sampling: linear snowball sampling, expositional non-discriminative snowball sampling, expositional discriminative snowball sampling. First, we will see the linear snowball sampling. In this, each selected sample is asked to provide reference to only one similar subjects. So one subject is there, he is given a reference to the another subject is given the third subject. So like that we have to complete our sample size. That is called as a linear snowball sampling. And expositional non-discriminative snowball sampling, in this technique, in this each selected sample is asked to provide references at least two similar sample, because of which the size of the sample size grow exponentially and large sample size can be achieved. So one is given two sample, then second is given another two sample, and third one is given the another two sample. So that is called as our sample size is increased exponentially, and it is a non-discriminative small snowball sampling. And exponentially discriminative snowball sampling is in this, initially one sample is selected and ask for two references for the similar subject. So one sample we are selected and we have to tell they have to give the references of the similar two subjected, out of which at least one subject must be active and another subject is not active. So active person, he has again given the two references, and non-active is not given any references. So like that our sample size will be increased. So this is the pictures. One sample is there, one is given the two references, one is active references and another is non-active. Active references again given to the two references, one is active and another is non-active. So like that we have to increase our sample size. So that is called as a snowball sample size. So these are the three types of the snowball sample size: linear, discriminative and non-discriminative. Now merit and demerits of this. The process is cheap. It is a simple and cost efficient. Need little planning for this sampling. And the demerit, representation of sample is not a guaranteed, because we are taking representation, it is not possible, and sampling bias is there. Okay, so this is the demerit of the snowball sampling. Next, it is the, so these are the different types of the sampling technique, that is a non-probability and probability sampling. So with the example, we had discussed this. Next, it is a sample size determination. It is a very much important. The sample size is defined the number of individual included into the conduct the study, means the sample size, it is a very much important how much sample size we have to take, and the number of individual included to conduct the research, it is called as the sample size. Then how large a sample do I need? Whenever you are going for the study, the researcher has to think how large a sample do I need. The answer will be depend upon the aim of my study. It is a depend upon the nature, it is a depend upon the scope of my study and the expected result of my study. Depend on that, I have to select my sample size, and all of which would be a careful consideration, and this is we have to done at the planning stage only. It is done at the planning stage only, the sample size calculation. So if sample denoted n is if sample is large, naturally it will increase the accuracy of our result, and it is a cost effective and complex because large sample we have to collect, so it is a very cost, means resources also we require. And if it is a sample is a small, so it is a decreased accuracy is there and less costly is there. Then as a researcher we have to think how we are going for the sampling, and who we mean how we are taking the that sample, and all these things we have to done during the planning phase only. So these are the factors influencing the sampling size. Factors influencing the sampling size, it is the resources available, means whenever we are identifying the sample size, we have to find out the resources available, means researcher need to decide if they have the sufficient resources available or not, then only he has to decide the sample size. Second is the nature of the study. The nature of the study we have to think. The size depend upon the type of the study carried out, means our type of the study, which is a qualitative study or which is a quantitative study, depend upon the that we have to select the sample size. Then sampling method use, means then we have to find out the which sampling technique we are using. There are the probabilities, so many sample type are there, non-probability, so many sample type of there. If we are conducting the large sample, so we can go for the cluster sample, we can go for the simple random sampling. Depend upon the type of the study, we have to select the type of sampling method. Then homogeneity, we have to see. Homogeneity is also affecting the sample size. If homogeneous, if our population is homogeneous, then samples, small sample may be the sufficient. If homogeneous populace, their answer are going to be a close, and taking a large sample, it is a very difficult and it is a unwise. So homogeneity sample, it is a, we have to think about that. Then effect size, we have to see. It is a relation between the independent variable and dependent variable is strong, then the small sample will be the sufficient. So we have to see the effect size, means dependent and independent variable, if it is a there relation is a strong, then we can go for the small sampling also. Then degree of confidence also we have to see. Confidence refer to our desire that we don't want to error to go beyond a certain limit. Therefore, high degree of confidence, the large sample size is okay. So degree of confidence is also affected by the sample size, as well as the cooperation and attrition rate. We have to see the attrition. Attrition refer to the condition that when initially willing to participate fail to continue the participation and leave the sample. In between the sample is dropped down. So that is the attrition rate also we have to think, and according to that we have to collect our sample size. So attrition rate also we have to think whenever we are going for the these are the some factors influencing the sample size, that is the resource available, nature of the study, which type of sampling method, homogeneity of population, effect size we have to find out, degree of confidence, as well as the attrition rate also we have to find out. Whenever we are going for the sample size in the qualitative study, it depends upon the more varieties, the bigger the sample size is needed. If we are having the different qualitative study and the more variables are available, so we had need the bigger size of the sample is needed. And the quantitative study, to determine the sample size, is a different diligent job. However, power analysis can be used to estimate as a accurate sample in a quantitative study. So we can see the power analysis is useful statistical application that make the estimate sample size for researcher a downhill and a fractionless job. It helps us to decide how large sample a researcher need to have. That we have to decide it. And this is not just finding the sample size as a single entry, but also involve the decision of some other factors necessary for the study in order to decide the sample size. So that is the two component of the power analysis we have to see. Power, the experiment specify the power that he or she wish to achieve. The sample size needed for the level can be the estimated. If we are trying to find the popularity of the book among the students, so we feel that 80% of students like to read this book. So we say here that power is 80%. And effect size, the effect of independent variable on dependent variables, means we have to see the relationship between the independent variable and dependent variable. If it is a strong, that we have to say that is the effect size. Example, we say 90 students should opt for the book, for example, then the 90 is the effect size we are looking for. So that is the effect size is there. Now next is the statistically determining the sampling size. One of the most difficult question in the research is what would be a sample size for the research study. The sample size is a function of number of things. The research design, what research design we are use in the sample in our study, variability of the key variables, how variable we are, how much variable we are using, and what are the variables we are using in our study. And if we are trying to estimate the population value, we are whether we have to estimate the population value or whether we are testing the hypothesis, that also we have to think about that. Each aspect of the sample size means depend upon the research design, depend upon the variable, which type of the study, the sample size is differ. There are the several approaches to determine the sample size. The sample size determination formula comes from the formula of maximum error of the estimated and is divided by the solving for the n. To estimate the sample size for the single survey using simple or systematic random sampling, need to know estimated the prevalence of outcome, design effect, size of total population, and level of confidence using the 95%. Sample size for the single population mean this is the condition in which the research question is about mean. Then we have to find out the standard deviations also, and typically the standard deviation of the population is estimated from the result of previous survey, from the pilot study, from secondary data, and from the judgment of the researcher also we have to find out. This is the sample size for the single population, means here we have to find out the level of significance which can obtain one confidence level. Standard deviation of the population we have to find out, maximum acceptable differences, and the value under the standard normal table for the given population of confidence level. So this is the one example. We can calculate the sample size like that. Next it is the if we are incorrecting the sample size, what are the result can be happen. So if we are not calculating the proper sample size, so wrong conclusion can be occur. Second one is a poor quality research can be taken place because sample size is not properly taken place. Waste of resources is there. Loss of money, because we have to lose the money because we are not getting proper qualitative research outcome. Ethical problem is must be there because of the not collecting the sample size properly, and delay in completion. Our research, that is the main objective, we have to complete our research in time. So because of the sample size is not correctly calculated, so it is a delay in completion can be taken place. Sorry, so these are the incomplete sample size can lead the problems. Next one is the sampling error. Sampling error is deviation of the selected sample from the true characters. We have to think about the sampling bias or the sampling error whenever we are going for the sample size selection. Sampling error or bias is a deviation of selected sample from the true characteristics, trait, quality of entire population. We have to think. The two basic reasons for the sampling error. There are so many reasons for the sampling error, but these are the two basic reasons. First is the chance error. Chance error, the error occur by the chance. Means it is error, it is because of the chance occur. For example, a comparative study on malnutrition in children in two cities, city A and city B. And we have to think B city having the large number of slum population, and it will affect the result naturally. So that is the chance error when we are comparing the malnutrition children into A and B, and we know that B is having the more slum city population. Naturally our result will affect. So that is called as the chance error. That is the sampling error. Next is the sampling bias. Sampling bias is a tendency to favor. It is a tendency to favor a selection of sampling unit that possess the particular characters. So, for example, a study on time spent by students on internet. For example, I want to assess the how much students spend their time on internet, and the students who participate will be those who are having the email ID. This study is a bias toward those who have email ID, and but those who don't have the email ID are excluded. So that is called as the sampling bias is there. So these are the some reasons where the sampling errors and sampling bias can be taken place. So how you can minimize the sampling errors and the bias? We have to avoid the convenient sampling, because convenient sample, it is one of the biggest sampling bias is there because of the convenient sampling. So try to avoid the convenient sampling technique. Second one is to ensure that the target population is well defined. Whatever the target population we are having, it should be the well defined, and the sample frame should be matched it as much as possible. And whatever sampling framing we are preparing, it should be prepared very properly. So and we have to select the proper sampling size. So sampling size, these are the two things we have to minimize the sampling error and the bias. We have to convenient sampling we have to most probably avoid, and ensure the target population is well defined, and sample frame should be matched as much as possible, and proper sample framing should be there. So this will help to minimize the sampling error. So these are the these things. So this is my topic regarding the sampling and the sample size determination. Take home message of this is we learn about the concept of sampling. Concept of sampling, steps involved in the sampling, different types of sampling method. Then there are the how to determine the sample size also. We must keep in mind whenever we are using the sampling technique in our research, we have to think what is our aim, what is our objective, which type of the study we are conducting. As per that, we have to select the proper sampling technique, so we can avoid the sampling bias and sampling error. So this is the take home message of my. Thank you so much. These are the some references where I have taken the data from the different books and the literatures. Thank you so much. for giving me the chance to present in national conference. So thank you so much, madam, for giving me a chance. I really thank all organizer, committee member of national conferences, Dr. Alka Taneja, madam, principal of Vibrant Nursing College, and Dr. Binu, sir, national NSS, giving me chance to present this topic in this good conferences. Thank you so much, sir.
Thank you so much, ma'am. If anyone having any question, please feel free to ask regarding this session. No, ma'am, your voice is not audible.
So thank you so much, madam, for giving me a chance.
Thank you, ma'am. Hello. Professor Deepesh Bhardwaj, sir. Are you there, sir? Okay. Thank you so much, ma'am. Moving forward, good afternoon to all. Before winding up the session, we are sharing the post-test link from the here. So please, everyone can fill this and submit it by the time. And I want to inform you that every day we'll share the pre-test and post-test link every day from the 3 days. Okay. Before the adjourning, I want to discuss about the tomorrow's session. Session will be started 10 a.m. in the morning. So please everyone join in the given time. Then total 3 session will be there. First session of the second day of the conference will be taken by the Dr. Suchita ma'am. Then second session will be taken by the Dr. Srimani Pillai ma'am. And third session will be taken by the Professor Parul Kibliwala ma'am. So this is the overview from the tomorrow's session. It is fair to conclude that the first day of conference was a great success and having great knowledge and experience from our skillful speakers. So much gratitude to our speakers, our guests, moderators, and participants. It's been honor to be among such a knowledgeable and productive time. Thank you one and all present over here for your valuable time and support. Hoping for your cooperation for the further session too. Again, thank you very much all. We'll share the post-test link from the here. So please everyone can fill this.
Because of some technical, hello, is it audible? Yes, hello, participants, is it audible?
Yes, yes.
Yeah, because of some technical glitches, we are very sorry. We will be sending you the post-test link through the email ID of the concerned registered, those who have registered, and in the WhatsApp group, we will be sending the post-test link within a short while. Okay. So we will be sending the post-test link in the email and also in the the WhatsApp group which we have created for the conference. Sorry for some technical glitches.
Okay, sir.
Thank you, sir. Thank you so much, everyone, for the joining. We'll hope your cooperation for the tomorrow session also. Have a good day ahead. We'll adjourning here.